So we were hoping to hear from Arjun Panessa from diabetes.co.uk today. Fortunately, he couldn't make it. He's working on a wider NHS program. But I've put together a few slides that can give you some options if this is a concern to you. So diabetes, we all know about it, don't we? Massive problem, and it's growing. The key things from these figures that I want you to understand are that 22,000 people a year are dying early because of it. If it wasn't there, they wouldn't die as soon. This is contributing a cost of almost 9 billion, which when you consider what I told you the whole healthcare expenditure was, it's actually a huge portion of that. It's about 9%. And actually, there are still millions of people at risk of this. 5 million are at risk, and this problem is only growing. So, what do we do? The thing about diabetes is we didn't think it was reversible. Once upon a time, it wasn't really something we did anything about. But actually, it's being shown otherwise. Does anyone know who this chap is? Yeah, so his name's Dr. Rangan Chatterjee. So this guy has a show on BBC called Doctors in the House, and he dealt with a couple of diabetics on the show. He's actually trained in the art of functional medicine, which is something I mentioned before. And he got, of two diabetics, I think he got one off medication and one significantly reduced. So that, I think, you might be able to still get that on YouTube these days. Probably still is on iPlayer if you want to check that out. Does anyone know who these guys are? They're less well known. Okay, Anita Rani, yeah, she's the presenter, so that doesn't really count. Dr. Zoe Williams and Professor Jason Gill. So these guys, they put a show on ITV called The Fast Fix, and they focused on diabetes. So they had a bunch of patients, I think 8 people who had diabetes, very severe, lots of knock-on effects. They all had fatty livers and all sorts. And over 2 months in a controlled environment, they had 800 calories a day in the form of shakes. And then they carried on the same thing for 2 months in their own environments. Now, they all had significant reductions in all of the effects of their diabetes as well as their need for medications. So this is very much reversible. There's more than we thought that we can be doing about this. So what kind of options are there out there that anyone, you yourself or your loved ones could be undergoing? The Low-Carb Program is something developed by diabetes.co.uk. They were going to talk specifically about that. Essentially, it's what it says on the tin. You're lowering the amount of carbohydrates that you take in, and they have been shown to have about a 26% success rate of complete remission with diabetic patients. The next step and related diet that people can try is the ketogenic diet. So it's very similar in the sense that you're just reducing the amount of carbohydrate intake, but it's probably a little bit more strict than the low carb one. So again, another resource there for you to look into. So if you're interested in those, sorry, give me one sec. Yeah, lowcarbprogram.com or dietdoctor.com are good resources for each of those. And alluding to a question we received earlier, in terms of intermittent fasting, now this is something that you can do in a variety of ways. Some people do, they fast until a certain time of each day. So for instance, I don't tend to have breakfast. Some people will fast for a whole day at a time. This week, there's a series of case studies that have come out in the BMJ, the British Medical Journal. So this is the most, recognized journal as far as we're concerned, from a group led by Jason Fung, who again is well versed in this whole functional medicine world. So we're taking 3 patients. They're long-term diabetics, all on insulin, and they have several other conditions going on. They all fasted for 24 hours at a time for a minimum of 3 times per week and a minimum of 7 months. So that would be things like water and stuff would be allowed, but no food intake. And looking at the numbers, don't get bogged down in trying to read that. I know it's small, but essentially what you need to see in terms of results are their diagnostic markers. The HbA1c significantly reduced for all 3. Actually, 2 of them were pretty much normal, and they all lost around 10 kilograms in weight. But most importantly to their well-being, they all came off their insulin, and the quickest in 5 days, the slowest within 3 weeks. Now, this is real, this is happening, these are real people, and their lives are dramatically changed from an intervention like this. This is the kind of thing we're trying to harness through the Outliers Project. So, I bet you're thinking, I can go ahead straight away and get on one of these diets. Don't do it alone. It's obviously there are risks when you're doing anything like this, and if you're misinformed when you go about it, then you might lead yourself into bigger troubles. So, as we've been saying throughout the day, this is a real safety precaution when it comes to things like this. Involve your GP just so they know what you're doing, and they can try and flag up for when things might go awry. And then, as we've mentioned already, there's this idea of functional medicine, and these practitioners are more well versed in lifestyle interventions in particular. So they might be able to give you a bit more specific advice. As I already mentioned before, if you want to deal with someone like that, this is my email address, drdil@hippocrateslounge.com. So, just to put into context, there is a certain someone in the room who you might recognize from the initials, who unfortunately was diagnosed with diabetes at the end of July. And this was what it looked like at the time. 87 kilos is the weight. The HbA1c was really quite high. And he was started on metformin 1 gram twice a day. Now, at the time, actually, he probably could have been talked through the whole process a little bit more, but that's a whole other issue. Not as value-based as I would have liked it to have been. But yeah, 2 months later, this is where we are. Look at the weight loss. That HbA1c number has halved. And actually, there's a real intention here to have him off meds by the end of this year. Right? This is just in our own vicinity, our own circle in the last few months. So these are real plausible things if you take ownership of your problems. So, any questions?
I've got one. I don't think it's very clear what intermittent fasting is. Can you just tell people what it is and why it's maybe a little bit hazardous to make a rapid change?
Yeah, so the idea of intermittent fasting is that you wouldn't eat for a defined period of time. There are different regimes of doing it. Have people heard of the 5-2 diet? So on that one, for 2 days a week, you would eat 600 calories, right? So in some ways, it just means restricting the amount of calories you have. But then there are other methods of doing it. So some people do it on alternate days, where they might do that restricted calorie amount. But I think it's good to, what I want you guys to take away from this is that I've seen a paper just now that's very, very official, very well recommended. I can lean on that protocol for what I would like to do. I can then go and talk to my GP and say, this is what I would like to do. They can do the relevant tests, they can flag up the relevant hazards, and then I can get moving in a very safe way. So yeah, so fasting can be as much as, a whole day's fast 3 times a week, which is what those guys did. Or it can be simply throughout the course of a day, I'm only going to eat within an 8-hour window, or you can even shorten the window. There's a variety of ways to do it. I think what I would advise with this sort of stuff is try and lean on what experience is already out there in terms of people who are using this stuff, and take the one that you think is going to work best for you in your day-to-day. For some people who don't work 3 days a week, that fasting regime might work, where if they feel like they're going to be irritable or not have as much energy, they can take those 3 days and just do their own thing. But if you're working every day, you might not be able to do that. So the whole hourly thing and having a small window in which to eat is more applicable.
What was the fasting pattern they used in the study?
So three times a week, 24-hour fast.
This is the risk with hypo.
So this is the kind of thing that you need to go into the details for how they prevented that. And there are risks of doing that. That's why I say don't do it alone and involve your GP, because there are risks with hypoing. I think with metformin in particular, it's less of a risk. With the other medications, you need to be careful. And what those patients will have been doing in that study is they'll have been checking their blood glucose on a regular basis. And that's how they will have weaned themselves off the insulin as well. It wouldn't have been something they just do just like that. They need to be very much measuring the whole process as they're going through.
If they are fasting for 3 days a week, and other days they are having a sort of intake of the calories, which is their body needs. So how does the body level out over the longer period?
So I think this is why we tried to go through fundamentals today, because I could have just sat here and told you fasting is the next best thing, right? If your things had great results with it, you should all have great results with it too. It's not, I don't think, I think as long as you've got the broader patterns that are a positive lifestyle overall, then integrating these things, 1, is easier, and 2, you don't really fall off the bandwagon as much. So I just, if I fast one day and then I eat McDonald's all day the next day, am I actually going to survive? Am I actually going to get rid of my diabetes? I don't think so. You guys all know that intuitively. I don't need to tell you that, right? So those sorts of things, I think if you have general positive habits when it comes to eating, and then when you've got a specific thing you need to intervene on, then that adds to it, and you've already got a positive behavior set which you're just adding to.
Coming to your answer, the body wants homeostasis. It's always looking for a balance. So that if you put in the right inputs, you'll get the right outputs. But it does take about a month to see changes in intermittent fasting. I've been doing it 20 years. It was the best thing I ever did.
Just to add that on the case study that we drew up there, no fasting whatsoever. That was purely, we didn't actually say what the interventions were.
Oh,
so,
yeah, true.
Just cleaning up the diet, just following the principles that we said earlier, getting the good things in first, reducing all of the bad stuff, so none of the sugars, reducing all of the complex carbohydrates that you just don't need as well. So like not excessive rice, not excessive potatoes, no flour whatsoever. So just following the principles earlier, and then the only form of exercise hasn't been intense, it's only been walking. So just trying to hit that 10,000k target, and 10,000k target.
Yeah, that just went up a bit.
Yeah. I mean, so it's just the 10k target
it was,
and prioritizing the good food.
Yeah, so
those two things alone have led to that 10k loss.
Exactly. So even following about 2/10 of what we've been talking about today, that's the result we've seen in 2 months. So think about what you can do if you've just implemented a couple of things from today. There's actually a lot. The reason we're throwing lots of ideas out there is because different people are going to have different things that work for them, right? So figure out yours. This is a very individual thing, and I'm trying to empower your individuality right now. Any other questions?
Yeah, so when you talk about removing flour and rice and potatoes and other things, in this sort of community, you might want to offer some alternatives because people will look at their plate.
All right. Okay. Yeah.
They'll see just dal on there and nothing else.
So a really good technique is to try and substitute and find the ingredients that will produce a similar thing, but not take away from your experiences of food as you know it. So we don't have straight up roti anymore, kanekti. We just have bajra, so that's millet, and makki, corn flour, instead of the normal roti. So actually the compromise, it doesn't really feel like it anymore, does it? Because you actually end up just, totally just transforming your experience, and you don't get that crash afterwards that we all get. That lunga crash is such a familiar feeling. I don't know about you guys. I'd rather not have it, so it's a good thing all around.
You can have a little bit.
Yeah, exactly. That's what I was talking about before. Yeah. Any other questions? I hope does that answer your question?
I saw a program on Netflix. This Australian guy, he was called Sick, Fat and Dying, and he was on 60 days worth of just vegetable juice. I mean, he did it, and he was at some drastic obesity level sort of thing. But at the end of that, is there any does it mess up your body in any way, just having liquids for 60 days?
So I wouldn't have any studies to lean on to be able to tell you about on that front. I don't know if you guys have come across anything like that.
I mean, there's a guy that did the Supersize Me as well, where he had McDonald's, and his doctor told him halfway through, stop, you're going to die. I mean, I wouldn't be doing juicing diets are rubbish. The juice here or there is okay, but we're going on the green juice diet, and nothing substitutes healthy lifestyles, slowly doing the right things, exercise like the guys are saying, substituting certain foods. Yeah, these things are just a fad, unfortunately.
Yeah, so I think the core thing that we're trying to do here is give you principles to work with, and I think the principles are what guide you in the longer term, because there are going to continue to be fads. You're always going to see them, right? Whether that's something you can actually work with, I don't know. But if you have a principle and a set of goals that you have a clear idea of what you're trying to get out of, and something to lean on as your fallback plan, I think if it becomes something you could do later when you're more comfortable, or whether there's more research, then do it. But for now, I don't think there's enough to say.
I just want to kind of underline what you guys are already saying, which is if you focus more on changing your baseline lifestyle, and then with big things that you want to change, so let's say you do have diabetes and you really want to shift that should be an additional thing. And then in trying to shift that's when you work with someone who is an expert. So let's say you are going to do something which is fasting related, you would work with an expert to get that done, but then what you're going back to is not going back to like the destructive habits that you had before. What you're going back to is just a measured lifestyle where you're already eating quite a lot of the good stuff, and maybe 20% of the time you're eating the bad stuff. So there's a lasting change which is there, and there's a short-term intervention where you're working with someone who knows about whatever they're doing. These sorts of things, they're good press, right? Like the sorts of things that everyone clicks on, really like the idea of having a silver bullet. And I think the idea is we let those people experiment with themselves. When it becomes proven, then work with an expert to get the benefits from it, which is just what that study's shown, that now the intermittent fasting is proven.
Yeah, the other thing with that, I would just say to just be wary of, just from, you know, anecdotal experience, is, you know, if you jump from diet to diet, you actually don't know where you're at anymore. And you don't know what effect that's had on your body that you now have to go and address. So that's why, you know, it's easier to be clear on your principles and your fallbacks rather than I'm just going to jump on every single little thing and refine as you go along.